Assalamu alaikum viewers. Today I am going to share the measurement and significance of abdominal circumference in pregnancy profile ultrasound. Most varied and less accurate among the standard parameters of gestational estimation, meaning abdominal circumference is the most variable and less accurate compared to fetal biparatal diameter, fetal femoral length, abdominal head circumference, occipitofrontal diameter. So abdominal circumference is the most variable and less accurate among the standard parameters of gestational age estimation. Best parameter for fetal growth or IUGR evaluation or estimate fetal weight. That means abdominal circumference is the best parameter for fetal growth measurement. And as we measure the fetal growth, we can determine IUGR, intrauterine growth retardation evaluation by abdominal circumference, that is estimated fetal weight, fetal growth and intrauterine growth retardation can be evaluated by abdominal circumference. Can be used in diagnosis of asymmetrical IUGR, macrosomia. IUGR may be symmetrical or asymmetrical. We will discuss regarding that in another lecture, but here I'm just explaining that we can determine asymmetrical intrauterine growth retardation by abdominal circumference. AC is taken with a true transverse image. Include the stomach, umbilical vein, middle third and or umbilical part of the left portal vein, also called portal sinus, and the spine. So in stomach, in abdominal circumference measurement, there should be stomach, fetal stomach, umbilical vein, umbilical part of the left portal vein, which is also called portal sinus, and the spine. This is the sonographical picture. Here in the diagrammatic one, we can see the stomach and the umbilical vein at the middle, stomach on the left side of the fetus, and the ossification center of the vertebra. Standard plane for abdominal circumference measurement. It is just around the umbilicus. So AC should be measured with a true transverse image, including the stomach, spine, intra-abdominal, umbilical vein, mid portion, and or left portal sinus. So these two are, one of them is diagrammatic picture and one of them is ultrasound picture or image of the abdominal circumference measurement. Biological variation and technical factors may contribute to the inaccuracy of abdominal circumference. So to measure the accurate measurement of abdominal circumference, we must be careful regarding these points. Images with a long section of UV should be avoided because an oblique cut through the fetus has been taken. If umbilical vein seen closely to closely to the anterior wall, the plane is too low or oblique. It should be a good circle, round, and no compression by external forces. Ribs may or may not be seen, but must be symmetrical if included. Kidneys or cord insertion should not be seen in the AC image. So kidney should never be there in abdominal circumference image. The plane is too caudal. If the kidney is visible, mean the plane is too caudal, and more cranial image should be taken as AC. Heart pulsation should not be seen in the AC image. The plane is too cranial. If heart pulsation is seen, then it will be a thoracic circumference, not the true abdominal circumference, or the upper portion of the abdomen. So AC should not be taken if there is anterior wall defects such as omphalocele, gastroschiasis, ectopia cordis, hepatomegaly, macrosomia, or ascites. So AC should not be taken, or AC will not be correct. The measurement of abdominal circumference will not be correct if there is anterior wall defects, meaning the fetal anterior abdominal wall defect, such as omphalocele. Omphalocele is the herniation or protrusion of abdominal organ, especially the gut, via umbilical orifice. Gastroschiasis. This is also the herniation of fetal gut or fetal abdominal viscera, but this is beside the umbilicus, not through the umbilicus. This is called gastroschiasis. Ectopia cordis, the cord itself, if it is a ectopic cord. Hepatomegaly, if fetal hepatomegaly present. Macrosomia or ascites. It is best taken when the baby supine or lateral, because if the baby is prone, then the rib shadow make it difficult to check the correct level. The AC is the growth parameter most commonly affected in pregnancy, complicated by abnormal fetal growth patterns. A macrosomic fetus will have increased abdominal circumference relative to gestational age. An asymmetrical IUGR fetus will have diminished abdominal AC measurements. Variation in AC in macrosomic and growth retarded fetus is due to differences in liver size and thickness of subcutaneous tissue in these two types of abdominal growth patterns. Thus, estimation of gestational age by abdominal circumference will lead to inaccuracies in fetus displaying either of these growth patterns. So actually, for dating or EDD measurement, we are not going to take abdominal circumference as first priority, but it has other significance. The greatest value of AC is in the estimation of fetal weight and in the diagnosis of fetal growth disorder. So fetal growth disorder and fetal weight are the main contributor of AC measurements or main outcome. AC is the single best parameter for the estimation of fetal weight, along with several other parameters such as BPD, HC, FL. Many ultrasound machine they provide fetal weight with 3 parameters like BPD, FL and AC. Some with 2 parameters like BPD, AC or FL, AC. Some with 4 parameters. It will depend on the setup, machine software setup. but actually most of the cases this pre-setup is set with the three parameters BPD, FL and AC. Then fetal weight is shown on the ultrasound machine. So today up to this.